Hello, I'm Marcy Turcos, one of the Derma Sciences clinical field specialists. I've been a physical therapist for almost 10 years and I'm a certified wound specialist, and I've been practicing in wound management for my entire career. Derma Sciences is an innovative leader providing novel and technologically advanced wound care products. Medihoney is our most widely known and utilized product, offering a truly unique therapeutic difference. It has been proven clinically successful on a variety of wound types of both typical and atypical etiologies. Medihoney was developed to manage chronic and stalled wounds. A chronic wound is one that doesn't heal in an orderly process or in a predictable period of time the way that most wounds do. Generally speaking, stalled wounds are those that don't progress at least 15% in 2 weeks. Full thickness wounds should be showing signs of healing in the first 2 to 4 weeks. Partial thickness wounds should be showing signs of healing in that first week to 2 weeks. If pressure ulcers do not show improvement in the first week, they may not heal in a timely fashion. Venous ulcers not showing healing greater than 30% in those first 2 weeks may not be healed at 6 months. Diabetic ulcers that are not healed 30% in the first 2 weeks only have a 9% chance to go on to healing in the first 3 months. Why do wounds stall? Because of the presence of necrotic tissue or a non-resolving inflammation? Because of bacterial contamination or infection? High levels of proteases can cause stalling, as can impaired perfusion and decreased oxygenation. Other causes could be physical trauma or systemic problems related to disease states, diabetes, autoimmune diseases, or cancer. Medihoney is a very versatile therapy. Because of that, it can have a positive effect on a number of these factors that may impair wound healing. For example, the low pH of Medihoney can decrease protease activity, which may help to reduce inflammation. The low pH optimizes the conditions for fibroblasts to migrate and proliferate during that organization and deposition of collagen. The low pH can also help to increase oxygen diffusion and may inhibit bacteria growth. The high osmolarity of Medihoney aids in the cleansing, debridement, and edema reduction. Because of Medihoney's multiple mechanisms of action, it can impact a variety of wound types. Let's look at some of the etiologies Medihoney can help manage. Here's a case of meningococcal septicemia in which the patient experienced 9 months with no relief. 3 weeks into Medihoney treatment, skin grafts began to take. The patient was released from the hospital after 2 months on Medihoney. In a necrotizing fasciitis case, Medihoney was started at 14 days post-op, and by 17 days post-op, significant healing was observed. This non-healing donor site was treated with Medihoney 14 days after a skin graft. 1 month later, you can see the progress of healing. This was due to 24 doses of radiotherapy. After just 6 days on Medihoney, you can see how much healing was achieved. And here are the results after just 2 weeks. This stage 4 pressure ulcer was chosen for Medihoney treatment because of the significant amount of necrotic tissue. After just 2 months of Medihoney treatment, the wound was presenting with a much cleaner base of granulation tissue. This was after an additional 2 months of treatment. For this radiation necrosis, Medihoney was started at 13 months and accomplished this much healing in just 6 weeks. A squamous cell carcinoma post-radiation showed significant healing after just 3 weeks on Medihoney. At 2.5 months, it was almost completely closed. This traumatic ulceration was completely closed after just 9 weeks on Medihoney treatment. Other etiologies Medihoney is used for are scleroderma, pincites, pyoderma, vasculitis, fungating tumor wounds, and hidradenitis. Higher standards are being applied all of the time to the treatment of stalled and chronic wounds. Medihoney has been clinically shown to jumpstart stalled wounds and for use as an effective product for debridement. Medihoney is an advanced wound care product that can help meet many of your wound care management goals. It's easy to train your staff to use, it may require fewer dressing changes, and may enhance patient compliance. Most importantly, Medihoney really helps to take the guesswork out of usage decisions. Medihoney comes in these configurations: the Medihoney calcium alginate dressing, the honey colloid, and tubes of 100% honey. Knowledge of wound science is increasing significantly every year. Dermasciences has dedicated itself to innovation and novel technologies that help this field advance. And Medihoney is the best evidence of our progress in this area. For more information about Medihoney and the full line of Dermasciences products, please see the other videos in this series.